My name is Anthony D'Ambrosio. I'm one of the brain surgeons here at the Neurosurgeons of New Jersey. I work out of our Ridgewood office in Bergen County. I'm board certified in neurological surgery, and I focus mostly on brain surgery and gamma knife radiosurgery. So I became a neurosurgeon for a lot of reasons, but I think now that I look back on why I really got into it, it was really to help people. Mostly because neurosurgery is complicated, brain surgery is complicated. I think one of the things that I do well, and I think is something that differentiates me, is just my ability to take something that's very complicated and translate it for people so that they can understand it. I think that's a talent that I work on, and it's not always that easy to take something that might have a lot of nuanced, complicated aspects to it that are very hard to even understand from a terminology perspective and bring it down to something that patients can relate to. So that they can feel informed about the decisions that they have to make, especially when it comes to something as important as brain surgery. It's a pretty scary thing, and when you're waiting, let's say, a couple days before you get a chance to understand what your brain MRI showed, right? One of the things that we try to do is we really want to calm people down. So I'll try to relate to them. I'll spend a lot of time walking them through pictures and giving them analogies that they can understand. We'll describe things in sizes and shapes that they can understand, and whatever it is that's on their mind, we address first, right? So if someone's very nervous about, am I going to be able to get back to work? Am I going to be able to see my grandchildren right away? It's that translation from something that's overwhelmingly complex and overwhelmingly potentially scary, and making it not scary, trying to bring down to just the facts that are focused on them. Nowadays, with all the information that's out there in the press and on the internet and on social media, it can be very overwhelming. We make sure that we kind of calm and quiet down all that outside noise and just bring it down to what matters. Give people short lists of things to think about. Give people specific tasks to just focus on what matters and block out all the other noise. We sort of walk them through that, and you can almost watch patients sort of get it while they're sitting in front of you. You can kind of watch their shoulders drop, watch their hands relax as they start to kind of understand that we're here to help them and educate them.